welcome to this virtual presentation. My name is Lisa Zhang. And here are our acknowledgements. So anti-incontinence, typically sling surgery at the time of pelvic organ prolapse repair, has been the subject of several large clinical trials. The evolution of incontinence into resolved, refractory, and de-novo urgency urinary incontinence after surgery over time has not been fully reported in literature. Our aim for this study is to improve patient counseling on the risk of refractory and/or de-novo urgency urinary incontinence in women considering a sling procedure at the time of prolapse repair. Hence, we sought to create a UUI outcome model to better characterize changes in storage dysfunction following surgery. We identified sequential records over a 6-year period for women with preoperative urodynamics followed by prolapse repair at our institution. We included women with POPQ stage 2 and above dysfunctional and at least 7 days of follow-up, and excluded women who had a sling removal at the time of prolapse repair. The chart review was conducted for the following variables, and overall, 139 women with chart review verified preoperative urodynamics followed by prolapse repair with and without sling placement. Our outcome is the presence of urge urinary incontinence following sling placement at the time of prolapse repair. We further classified patients into never, de novo, resolved, or refractory urgency urinary incontinence using their pre- and post-operative state. Data were analyzed in SAS using chi-square, t-test, and Kaplan-Meier method. Table 1 shows the baseline characteristics of the two groups stratified by their sling placement status. The sling and no sling groups are well matched, except that the sling group is slightly younger. As expected, the sling group had a higher rate of stress urinary incontinence pre-op, and the two groups have very similar urgency urinary incontinence rate prior to surgery. On urodynamics, the two groups are well matched for the capacity and Qmax. Following sling surgery, there was significant improvement and normalization of the rate of SUI in the sling group. The rates of post-op SUI symptoms and further treatment is similar in sling versus no sling group. On the other hand, in terms of urgency urinary incontinence, women who underwent sling placement had a higher rate of post-op subjective UUI symptoms. However, there's no significant difference for requiring additional second or third line overactive bladder treatment. All women were assessed for the need of further treatment for post-operative incomplete bladder emptying following surgery. This table summarizes the rate of further treatment stratified by sling placement. As you can see, the rate of all further treatment were similar, except for indwelling catheter use. However, this is mostly transient use in the immediate post-operative period, as you can see that only 1 out of the 81 patients in a sling group eventually required a sling incision. We then generated a Kaplan-Meier curve model to assess the proportion of women not reporting stress urinary incontinence at the time of longest follow-up. Here you can see the solid line represents the no sling group and the dotted line is the sling group. We found no difference in the rate of dry women at longest follow-up with or without sling placement. This is the Kaplan-Meier model of women not reporting urgency urinary incontinence at longest follow-up. The higher line or slower decline means there are more dry women and also better outcome in terms of urgency urinary incontinence. Again, solid line, no sling group, and the dotted line for sling group. You can see there is a separation of the two lines at all time points across the x-axis, which is up to 4,000 days, which meant that there is a greater proportion in the no sling group that had not reported any UUI at the time of longest follow-up. This trend approached but did not achieve statistical significance. For Table 3, we characterized women based on the change in their UUI symptoms after surgery. Women who had never urgency incontinence meant that the woman had no urinary urgency symptoms prior to surgery, and they still had no symptoms after surgery. And this was similar in both the sling and no sling group. For women who developed de-novo UUI, which meant they had no urgency symptoms prior to surgery, but developed new urgency symptoms after surgery, this is higher in the sling group. However, this did not achieve statistical significance. And for the women with resolved UUI, we can see that the no sling group had a higher rate of resolved UUI compared to the sling group. However, this also did not achieve statistical significance. And lastly, and interestingly, for refractory UUI, which meant the woman had urgency symptoms prior to surgery and still have urgency symptoms after surgery, the rate of refractory UUI is higher in the sling group. 38% of them still had refractory UUI in the sling group, compared to only 24% in the no sling group. And this result goes along with the Kaplan-Meier curve that we just showed in the previous slide as well. Moving on for discussion, the strength of our study includes that we have a relatively large number of patients with preoperative urodynamic study followed by prolapse repair with or without sling placement. All charts were personally and directly reviewed for accuracy, and for our preoperative stress and urgency urinary incontinence variables, they were well characterized. The limitation of the study is that this is a retrospective study, so there's a potential for selection bias and information bias. The post-op urgency outcomes were mostly subjective, and we may not have captured all the additional treatment received by patients, given this is a retrospective chart review. And so overall, for interpretation of results, we concluded that the sling placement was associated with a higher rate of refractory urgency urinary incontinence, and there was no significant difference in the rate of de-novo or resolved urgency urinary incontinence with or without sling placement. In conclusion, refractory urgency urinary incontinence is associated with sling placement at the time of prolapse repair. All patients should be properly counseled on the risk of UUI prior to surgery. And further research is needed to identify women at risk for refractory urgency urinary incontinence after sling placement.